Hi. I'm Vanessa, the primary nurse taking care of Mrs. Jones. I'll be walking you through the Sherman process for calling a stroke alert. It's not a process that we go through frequently, so it'll be great to have a refresher. Mrs. Jones is a 68-year-old female admitted to the surgical unit for a nephrectomy due to a renal mass. Her surgery was yesterday. She has history of atrial fibrillation on aliquis. Due to her procedure, her anticoagulant is on hold for 2 days. She is not on a cardiac monitor.
Mrs. Jones, would you like for me to help you to the bathroom while I'm here?
Yes, that would be great, thank you.
Cash.
Oh no, Mrs. Jones, you seem off balance now, and I'm having a hard time understanding you. Let's get you safely back to your room so I can call your nurse right away. Vanessa, please come to Mrs. Jones' room right away. I was assisting her in the bathroom when she started slurring her words and became off balance.
I will be right there.
The BE-FAST assessment tool is an algorithm that helps identify persons having an acute stroke. The first part of the algorithm is B, balance. The patient will have a sudden loss of balance or coordination. Next is E, eyes. The patient will have a sudden loss or change in vision in one or both eyes. Next is F, face. The patient may experience sudden numbness and tingling or drooping on one side of the face. Next is A, arm and leg. The patient may display unilateral weakness in their arm or leg. Next is S, speech. The patient may have sudden slurred speech, difficulty talking, or confusion. Lastly is T, time. It is essential to know the last known well or the time of symptom onset because this impacts that patient's eligibility to receive tenecteplase. Mrs. Jones is having slurred speech, facial drooping, and a sudden loss of balance. I'm concerned she may be having an acute stroke. We better call for additional help. Should I call a rapid response team adult or a stroke alert? I'm pretty confident that she has something serious going on. I'll call a rapid response team adult because I know that only the rapid response nurse is able to activate a stroke alert.
My BE-FAST assessment is in agreement with yours, Vanessa. I'm going to activate a stroke alert on Mrs. Jones. Can you call ERCT and let them know that we are coming?
I will call them right away. I'll also bring my computer with us so that you are able to page telestroke.
Hi Mrs. Jones, my name is Dr. Clark. I'm the intensivist in our ICU. I'm going to do a VAN assessment to help me determine if you might have a large vessel occlusion. This assessment looks at vision changes, if you are experiencing aphasia and neglect to one side of your body. This will tell me what kind of scan you need.
I'm paging telestroke with the preliminary information. When the scan is complete, we will go to ICU 14 for triage.
Mrs. Jones, now that you are in ICU, the telestroke physician will do a NIH assessment to help to determine the severity of a stroke and determine next steps. They will also go over the results of your CT scan.
Hello, I am with Advocate Telestroke. I am a neurologist who specializes in treating strokes, and my role is to perform an assessment, review the CT scan, and make treatment recommendations. When this is completed, I will hand off to the intensivist for continued care.
Depending on the results of the scan and recommendations from telestroke, I will either bring the patient back to their room or the patient will be transferred to ICU. If the patient is determined to be appropriate to go back to their room, I will finish the rapid response with the RRT nurse and receive orders from the hospitalist. They may consult neurology and order neurochecks. I will make sure to follow the orders that I receive and educate the patient on nursing care going forward. If it is determined that the patient needs to be transferred to the ICU for a higher level of care, I will provide bedside report to the receiving nurse. I will then bring the patient's belongings to their new room and complete my charting. If I have any further questions, I can use the stroke resources on my unit or call the stroke coordinator, Kelsey, at 671570.
Thank you for taking such good care of me.